For today, we are going to discuss about the menopause. Let's go to with the topic. So, menopause is like it is defined, and like menopause means permanent cessation of the menstruation at the end of the reproductive life due to the loss of ovarian follicular activity. So, like it is a physiological phenomena that there is a permanent cessation of the menstruation at the end of the reproductive life, and it is due to the loss of follicular activity. It is a point of time where last and final menstruation occur, and the clinical diagnosis is retrospective, confirmed by the amenorrhea for 12 consecutive months without any other pathology. So, for the premature menopause, women less than 40 years of age, we have to do the hormonal diagnosis by measuring the serum FSH, which is greater than, if it is greater than 40 international unit per liter at two value at least 1 month apart, then we can diagnose it as premature menopause. So let's know about the climacteric phase. It is also known as menopausal transition phase and phase of aging process during which a woman passes from a reproductive to non-reproductive stage, like from the reproductive to non-reproductive stage. Like this phase is climacteric phase, covers 4 to 10 years on either side of the menopause, like 4 to 10 years on either side of the menopause. And the perimenopausal period is like the period around the menopause, like 40 to 50 years. And the premenopause is the part of the climacteric before the menopause, when the menstrual cycle is likely to be irregular, like initially short cycle and then long cycle occurs. So post-menopause is the phase of the life which comes after the menopause. So what is the age of the menopause is like age at which the menopause occurs is genetically predetermined, and it is not related to the age of the menopause, the age of the last pregnancy. So age is not related to number of pregnancy, lactation, use of oral pills, socioeconomic condition, race, and height or weight. So, but it is depend on the cigarette smoking and severe malnutrition, as thinner women have tendency to have early menopause. So average age ranges from 45 to 55 years for the age of menopause, and in worldwide the average is 51, and in India, Nepal, 47 year is considered as average age for menopause. So endocrinology of climacteric and menopause, like hypothalamus pituitary gonadal axis few years prior to menopause, along with the depletion of the ovarian follicle become resistant to pituitary gonadotropin. So like the gonadotropin which is releasing, then like gonadotropin hormone, then that like follicle of the ovary become resistant to the action of the gonadotropin like FSH, LH. Then and there is resistance from to the gonadotropin, so less follicle will form the ovum, and the effective folliculogenesis is impaired with diminished estradiol production. So estradiol production is also diminished, and serum estradiol before menopause is 50 to 300 picogram per milliliter, and the after menopause is 10 to 20 picogram per milliliter. So there is no endometrial growth, and then there is absence of menstruation. So this decreases the negative feedback effect on the hypothalamus pituitary axis, resulting increase in FSH, so that it decreases the like estradiol. Also in the figure, like estradiol will decreases the negative feedback, so that the FSH will be increased. So we can increase level of FSH also can be diagnosis, and there is also a decrease in inhibin due to the decreased follicular activity, so that the inhibition to the FSH hormone is less, so that FSH will be increased. So like here we can see that this is the menopausal phase, where the menopause occur in the woman, and the estradiol, which is the hormone of the reproductive age, it is greater before the menopause, and the estrone is which is lesser. Then after the menopause, the estradiol level tends to decrease rapidly, and then the estrone level will be greater than the estradiol level. So the main hormone in the postmenopausal woman is strong, and here we can see that LH and the FHS level both are increased, but prominently FHS is increased because here in the diagram also decreased follicular growth, which decrease the estradiol, so that the positive, like the negative feedback of the estradiol to the pituitary is diminished, so that the FSH and LH will be increased. Then both will be increased, and then I have already talked about that there is decreased follicular growth, so that the decrease inhibin also, so that inhibin used to decrease the FSH, but if there is less inhibin production, then there will be the marked and prominent FSH secreted from the ovary, and then there will be high increase of the FSH during the menopausal phase. So for the diagnosis of the menopause, then here we can see at the menopausal phase, like we can see after the 1 to 2 years, then only estradiol level decreased to the lower level, but the FSH level is also already increased in the phase of menopause. So FSH level, with the help of FSH level, diagnosis is more prominent and marked. So there is a small atrophic ovary, and the from the adrenal gland there is the secretion of androstenedione, and from the peripheral cell and the muscles there is aromatase, which converts the androstenedione to the estrone, which is the predominant hormone in the postmenopausal woman. The level of the estrone in postmenopausal woman is 30 to 70 picogram per milliliter. There is total like overall total androgen production is decreased, so that there is decreased libido, but like androgen also decreased, but estrogen is more decreased, so that there is relative estrogen axis, so that mild hirsutism, like the menopausal woman can have mild hirsutism in the body. So what changes occurring after the menopause, like this is the normal genital organ of the female before the menopause, and the postmenopausal organ, this is okay. Let's see at the ovary, like ovary it shrink to the size from this, and then it becomes more wrinkled and white color. In the fallopian tube also, like here is more diameter, but here shows the sign of the atrophy. And for the uterus, like uterus become smaller, and the ratio become 1:1. So like the ratio decreases to 1:1, and the endometrium also, in the normal here is thickened endometrium, but here is like thin and atrophic endometrium is seen. And in the vagina, like the canal become narrow, and the epithelium become thin, and the rugae, which is seen clearly here, is rugae become flattened, and pH become alkaline and become more pale, which you can see in the figure also. So in the vulva, like it shows the feature of atrophy, labia become flattened, and the pubic hair also become less. So what are the effects in the cardiovascular system is like high risk of cardiovascular system cardiovascular disease in postmenopausal due to the deficiency of estrogen. Usually estrogen protect from the cardiovascular disease by like it increases the HDL, mainly HDL2, and it decreases the LDL and total cholesterol, and inhibit platelet and macrophages aggregation at the vascular intima. So and it stimulates release of nitric oxide and prostacyclin from the vascular endothelium, and prevent atherosclerosis by its antioxidant property. So like SGL2 is the best predictor of the coronary artery diseases in the postmenopausal woman. So there will be decreased SGL2 in the postmenopausal woman due to deficiency of the estrogen, which helps to increase the SGL2 in the reproductive woman. So there is less cardiovascular disease occurring in reproductive women, which compared to the male. So for the bone metabolism, like osteoprotein, it binds to the rank ligand, so that this cannot bind to the rank, and then osteoclastic activity can be inhibited. So estrogen secretes the facilitate the secretion of the osteoprotein, so that the osteoclastic activity is decreased in the normal condition. Like if there is less estrogen, then the osteoclastic activity is increased, and the balance between osteoblastic and the osteoclastic activity is diminished. Like it also depends on other factors like age, nutrition, genetics, and endocrine. Following menopause, there is loss of bone mass by about 3 to 5% per year, and there is high risk of fracture due to osteoporosis, which is reduction of bone mass, but bone mineral to matrix ratio is normal. And the estrogen inhibit osteoclastic activity and inhibit release of interleukin 1 by monocyte. And the most common fracture which we can see in the postmenopausal women due to decrease in the estrogen is vertebral compression fracture, and other fracture like wrist fractures are also common. It also increases the absorption of calcium from gut, stimulate calcitonin secretion, and increases 1 to 5 D hydroxy vitamin D, so that estrogen protect from the bone depletion. But if there is less estrogen, then these protective things should not, there is no presence of these things, so there is more osteoclastic activity in the postmenopausal women. So what are the symptoms of postmenopausal, like menopausal symptoms are like, in the majority there is no symptom evident, but important symptoms are like vasomotor symptom. Like characteristic symptom is hot flush, which is characterized by the sudden feeling of heat, increased by sweating, redness, and increased heart rate. And the thermoregulatory center in association with gonadotropin releasing hormone center in the hypothalamus is involved in this etiology of the hot flush. And there occur like 75% of the women who have symptoms like hot flushes occur, and it is peak at 1 to 2 year and average last for 4 to 5 year. And this is the most common symptom for which women seek for hormonal replacement therapy. Like other symptom, rather than other symptom, this is the most common symptom like hot flushes, which affect her daily activities. So women like postmenopausal women tend to seek the hormone replacement therapy because of these symptoms. So other symptoms like genitourinary symptom like dyspareunia because of the atrophy of the vaginal wall, and the vaginal infection because the normal barrier of the vagina is diminished as pH is increased, and postcoital bleeding because of the thin endometrium, like thin vagina wall, postmenopausal bleeding, urinary tract infection as the natural barrier is not there or less, and urethritis and cystitis, and the genitourinary prolapse because the antiflexion and the antibiotic angle is diminished due to the less estrogen, and the stress incontinence because of the neck of the bladder is also compromised due to deficiency of the estrogen. So skin and hair, there is the thinning, loss of elasticity, and wrinkling of skin as there is decrease of collagen, and the pores string wrinkling around the mouth, and crow feet around the eye are characteristic, which you will see in the figure also. So crow feet like this type of like wrinkles, and the pores string around the mouth, this type of wrinkles is seen. And psychological changes like increased frequency of anxiety, headache, insomnia, irritability, dysphagia, and depression, and dementia, mood swing, inability to concentrate. Estrogen increases the opioid activity in the brain, which is important for the memory. So if there is less estrogen in the postmenopausal woman, then there is like less memory, can be less memory due to decreased opioid activity in the brain. So for the diagnosis of the menopause, like cessation of the menstruation for 12 months during the climacteric, and the appearance of menopausal symptom, hot flushes and night sweats, and the vaginal cytology shows the maturation index of at least 10, 85, and 5, like mainly which that maturation index like basal, intermediate, and the superficial cells In the reproductive woman, superficial cells grading of the superficial cells is higher, and in the menopausal woman it is lesser, because it is mainly controlled by the estrogen, and this thing should be seen in the vaginal cytology. Like serum estradiol level is less than 20 picogram per milliliter, and serum FSH and LS greater than 40 milli unit per milliliter, and we should have to take 3 value at week interval required. So for the management, like prevention, spontaneous menopause is unavoidable, and for the artificial menopause, which is induced by the surgery or by the radiation during reproductive period, can be preventable or delayed. And for the counseling, like every woman for of the postmenopausal symptoms should be adequately explained about this physiological event, so that it will remove her fear, minimize the symptom of anxiety and the depression and the insomnia. Reassurance is also essential in the counseling and the management. So for the treatment, like there are hormonal treatment and the non-hormonal treatment. Let's go to the non-hormonal treatment. Like nutritional diet, which is high in calcium and the protein, is helpful, and the supplementary calcium 1 to 1.5 gram can reduce the osteoporosis and fractures. Like exercise, weight bearing exercise, walking, jogging can also increases the bone density, and the vitamin D supplementation along with the calcium is also done, and the exposure of sunlight enhance the synthesis of the cholecalciferol from the skin, and the cessation of the smoking and the alcohol is also must be done. So biphosphonate, like alendronate, etidronate, it is mainly used, and it should be used in the like empty stomach, and then patients should take more water, and patients should not allowed to sleep for 30 minutes, because it has the side effect of esophageal ulceration. So we have to take this in the empty stomach. So when used alone, cannot prevent hot flushes, atrophic changes, and cardiovascular diseases. So fluoride can also be given, like it prevents the osteoporosis and increases bone matrix, given at the dose of 1 mg per kg for short term only, and calcium supplementation should be continued. Long term therapy induces the brittle bone diseases, like so short term therapy must be used at a given dose. So calcitonin, like it inhibits the bone resorption. Simultaneous therapy with the calcium and vitamin D should be given, and it can be given either by nozzle spray or by the injection. It is suitable when estrogen therapy is contraindicated. So selective estrogen receptor modulator, like HRMS, like ideally there must be if like there is the receptor modulator, like estrogen act something in the some receptor and something in the another receptor. So like name suggests that receptor modulator. So in ideally, like bone density must be increased when we add this SERMs, and the blood HDL by LDL ratio is increased, breast cancer is decreased, endometrium cancer and in the liver clotting factor is decreased. Most best drug found is like raloxifene. It has all good effect, but it increases the like clotting factor, so that there is risk of thromboembolism, and it doesn't improve the heart flushes and urogenital atrophy, because the site it is acting are only these, and the other drug are like tamoxifen, which has a side effect of thromboembolism and the breast cancer also. So like clonidine can also be given, like it is alpha adrenergic agonist, may be used to reduce the severity and duration of hot flushes, and it is helpful when estrogen is contraindicated in hypertension, because it can be also given in hypertension also. So thiazide, it reduces the urinary calcium excretion. So in the body there is a need of the calcium, so it increases the bone density when combined with the estrogen. Paroxetine, a selective serotonin reuptake inhibitor, is effective to reduce hot flushes, both the frequency and the severity. And the gabapentin, which is analog of GABA and found to be effective in this case. And the phytoestrogen containing isoflavins are found to lower the incidence of vasomotor symptom, osteoporosis, and the cardiovascular disease. So protein found effective to reduce vasomotor symptom, as it also acts as SCRMS. Let's go to the hormonal replacement therapy. The indication of the hormonal replacement therapy is like to relieve the menopausal symptom and the prevent the woman of like prevention of the osteoporosis and to maintain the quality of the life in the menopausal years. Like a special group of women to whom HRT should be prescribed is like premature ovarian failure, gonadal dysgenesis, and the surgical or radiation menopause to maintain the estrogen or the hormone from the outside. So benefit of the HRT are like improvement of the vasomotor symptoms, improvement of the urogenital atrophy, increases in bone mineral density, increased risk of vertebral and hip fractures, and the reduction in colorectal carcinoma and the possibility of the cardio protection. So risk factor of the osteoporosis in the woman is like family history, age, which is elderly, race, Asian, white race, lack of estrogen, body weight, low BMI, early menopause, surgical radiation, dietary, decreased calcium and the vitamin D, increased caffeine and smoking, thyroid disorder, hyperparathyroidism, malabsorption and the multiple myeloma. So the risks of the HRT are like endometrial cancer when estrogen is given alone with intact uterus. It causes the endometrial proliferation, hyperplasia, and the carcinoma. And it is advised to add progesterone to counterbalance such risks because like estrogen will increase the growth of the like follicular phase, like it increases the growth and there will be hyperplasia. If there is no addition of the progesterone, then there can be the higher risks of the endometrial carcinoma. So in the breast cancer, like combined effect increases the risk of breast cancer, slightly relates to the dose and the duration of the therapy. And the venous thromboembolic disease, it increases the risks with combined oral estrogen and progestin. Transdermal estrogen does not have the same risks compared to the oral estrogen. So for the coronary heart disease, like combined HRT therapy shows relative hazard of coronary heart diseases. Like in the lipid metabolism, like it increases the incidence of gallbladder disease has been observed following ERT due to rise in cholesterol. Dementia, Alzheimer's disease are also increased. Contraindication of HRT undiagnosed, if in HRT, like undiagnosed genital tract bleeding, if there is presence of this, then the HRT is contraindicated. Estrogen dependent neoplasm in the body, history of venous thromboembolism, active liver disease, and the gallbladder disease. So if there is contraindicated, then SSRI, selective septin reuptake inhibitor, and non-selective reuptake inhibitor like paroxetine, venlafaxine can be used. So the available preparation for HRT is like if uterus is present, then we have to give the estrogen plus progesterone. If estrogen is given alone, then there is a risk of endometrial carcinoma as discussed earlier. And if uterus is absent, then estrogen is alone. Except if there is a history of supracervical hysterectomy, only the part like above the cervical, above the cervix, there is the hysterectomy, then we have to administer the estrogen plus progesterone both. And if there is history of endometrial carcinoma and the history of endometriosis and the history of endometrial tumor of the ovary, then we should not give estrogen alone in this case. So commonly used estrogen are like conjugated estrogen, or micro used estradiol progestin. For the progestin, like medroxy progestin and mainly dydrogesterone and micronized progesterone can be given. And the one thing we have to always think about that we should have to use the lowest effective dose and for the short period of time. So these things we should have to keep in the mind, so that to it is best thing to know. Okay, for the oral estrogen regimen, like estrogen conjugated equinestrogen is given daily for the women who had hysterectomy, and this estrogen and cyclic estrogen, like for women with intact uterus, estrogen is given continuously for 25 days, and progestin is added for last 12 to 14 days, so that there will be cyclic progestin. And there can be also continuous estrogen and progestin, so that continued combined therapy can prevent endometrial hypoplasia. Other are like subdermal implants, percutaneous estrogen gels, transdermal pads, vaginal cream, and the progestin tubulons can be used in different conditions. So monitoring prior to and during the HRT are like physical examination. We should have to do the physical examination, blood pressure recording, and the breast examination and mammography, cervical cytology, pelvic USG to measure endometrial thickness, lipid profile. If the triglyceride is greater than the 500 mg per dl, then HRT should be contraindicated. Any irregular bleeding should be investigated, and the ideal level of serum should be 100 picogram per milliliter during HRT. So serum level of estradiol is useful to monitor the HRT therapy, then serum FSH. So these things should be considered monitoring prior to and during HRT. So the duration of HRT use is like HRT I have already talked about for the short period of time and the lowest dose, and the reduction of dose should be done as soon as possible, and menopausal women should maintain optimum nutrition, ideal body weight, and perform regular exercise. Individual women should be given informed choice as the regard of the relative merits and possible risks of the continuing HRT. So for the abnormal menopause, like there can be premature menopause occur below the age of the 40, and the delayed menopause fail to occur even beyond 55 years. And the most common cause is like constitutional uterine fibroid, diabetes mellitus, and the estrogenic tumor of the ovary. So for the artificial menopause, like permanent cessation of the ovarian function done by the artificial means like surgical or the removal of the ovary or the by the radiation. So for the surgical, like menstruating women who have bilateral oophorectomy experience menopausal symptom, it is sometimes more troublesome than natural menopause. And for the radiation, like ovarian function may be suppressed by external gamma radiation in women below age of 40. It is not permanent, may resume after 2 years, and even consumption is possible. Intercavity introduction of radiation can cause castration effect by destroying the endometrium and also by depressing the ovarian function. Menopausal symptoms are not so intense as found in surgical menopause or the menopause following surgical external radiation causing menopause in the intracavity introduction of the radium. So these are the reference, and thank you. So I'll be doing in next for the GDM. So rather than from this slide, I'll try to write like try to do from the different way to make video. Hope you'll give me feedback in that. Thank you for watching this video. Thank you.